Minister of Health and Wellness Dr. Christopher Tofton says there is some movement in the right direction where Jamaica's COVID-19 positivity rate is concerned. He gave an update of the ministry's epidemiological assessment during his contribution to the sectoral debate this week.
Minister of Health and Wellness Dr. Christopher Tofton says Jamaica's COVID-19 virus reproductive rate has fallen over the last 4 weeks.
Our reproductive rate over the last 4 weeks, Madam Speaker, have moved from 1.3%, 1.3 to 0.9, I should say, from 1.3 to 0.9. This really means that we are moving in a direction where the spread of the virus is decreasing or declining, and below 1, not ideally where we want it to be. We would like it to be somewhere in the region of 0.7. But certainly going below 1 means the spread, the rate of spread that each person with COVID is responsible for is at a rate that is less than the capacity to double or increase the extent of the virus beyond our capacities currently.
He says the reduction in the number of cases is due mainly to lockdowns and other restrictions on movement. Dr. Tofton says his ministry is very mindful of the sacrifices made by the Jamaican society by obeying the restrictive safety measures.
Sacrifices, however, Madam Speaker, at the individual level, the family level, the community and organizations, sacrifices by all. These sacrifices have resulted in many hardships, we understand, for the men and women who have had to give up their livelihoods and bear the economic brunt of lockdowns or other forms of restrictions and movement. And I have to say, on behalf of the entire government and the Ministry of Health and Wellness team who have been in the field championing the response, that we understand the sacrifices and we say thanks to the Jamaican people.
Minister Tofton told his colleagues that some 135,000 Jamaicans received their first dose of the AstraZeneca vaccine. And while population inoculation has been relatively successful thus far, vaccine supply remains a challenge.
The slow rate of vaccination can result in higher rates of mutation and the possibility of low efficacy rates for vaccines that have already been administered. And this is advocated by the scientists and more recently by the Director General of the World Health Organization, Dr. Tedros. And it is something that we have to manage carefully. And as we look across the world, we see where variant strains of the virus are popping up. And that is an area that we have to manage even while we seek to source vaccines, but also champion the cause of vaccine equity across the globe.
The Ministry of Health and Wellness will begin administering the second dose of the COVID-19 vaccine in May, and persons are asked to visit the vaccination sites on the date and time indicated on their COVID-19 vaccination card.